Good evening, everyone. This is our second session on the fertility module. We have another pre-call session with us, and the role player is ready. For any fertility module, we advise to ask the basic questions regarding pertaining to fertility and go on to their specific concerns and detail a management plan. At the same time, remember to look at their clinical condition and mention points related to that also, and go on with that in your 10 minutes window. So without wasting much time, here is your station. Your time will be starting now, dear. I hope you're able to see.
The previous investigation, ma'am.
Yes. Here you go. Okay, your time is up.
Hello, I'm Dr. Fatma in the fertility clinic. Can I confirm your name and age, please?
Doctor, I'm Emma Wilson. I'm 33 years.
And how do I address you?
You can call me Emma.
Emma, nice to meet you. I see that you are trying to have a baby and you are here to address your concerns. Am I right?
Yes, doctor.
Okay. Do you have any particular concerns, Emma?
Doctor, it's just that we've been trying for the past 4 years, and I've come here to talk about IVF, doctor.
Okay, I will address all your concerns, Emma, but may I ask you a few questions to understand you better, and then we would formulate a safe management plan for you, and also I will give you some written information about what all we have discussed. Is that fine?
Yes, doctor.
Emma, I see that you've come alone today. Next time we can have a discussion with your partner also, okay? So, Emma, tell me about your journey so far. What have you been doing, and what all treatments have you been taking so far?
Yeah, doctor. Actually, we've been married for 6 years, but then since the last 4 years, we've been trying to conceive, but nothing is helping. Then around 3 months back, we went to this fertility clinic. We got some investigations done, and they said my tubes were normal, and they told I have something called the PCOS, and they were like telling me to you must reduce your weight and all. And I was also very sincere. I've been trying diet and exercise, walking as well, but nothing is changing, doctor. So I've tried everything. I've come for IVF, doctor. I just want this to happen. We cannot wait more than this.
Yeah, I see, Emma, that it must be really frustrating now for you. But let me ask you, do you have any excess hair growth?
Yeah, yes, I do have. It's
any okay, and acne?
Yes, doctor, I do have it.
Any problem with weight gain or intolerance to heat or cold?
No.
Okay, and are your menses regular?
No, doctor, it just comes once in 2 to 4 months.
That's and when was your and when was your last period?
Just 10 days back.
Okay, and have you used any contraception in the past?
No.
And any okay, and your cervical smears are you been doing? Are they normal?
Yeah, that's normal.
And have you ever been pregnant, Emma?
No.
Okay, some personal questions I need to ask you. Is that okay?
Yes.
How long? You try on your fertile period?
Doctor, I'm having irregular periods.
Okay, yeah, understandable.
1 to 3 days, once in 2 to 3 days. We don't know what is the
fertile. Understandable. And so Emma, I want to just ask you a few questions about your partner. How long have you been in the relation with him?
6 years, yeah, doctor.
Okay, and his BMI?
My husband's, it's normal.
Okay, and does he have any problem with erection, ejaculation, or any problem with intercourse?
No.
And do you have regular intercourse?
Yes, doctor, I told you it's around 2 to 3 days, once in 2 to 3 days.
Okay, and your any history of any sexually shared infection?
No.
Okay, and Emma, I just want to know, do you both smoke?
My husband doesn't, but I do smoke, doctor.
You smoke?
Yes.
Okay, Emma, and do you take alcohol?
No.
Pardon me to ask, any recreation drugs?
No.
Okay, Emma, smoking, of course, it's not good on your health. Also, for your fertility, it is not very good. So, Emma, we would advise you to stop smoking in this period where you're trying to conceive. Where you're trying to conceive. So, kindly, I will connect you to the NHS Stop Smoking Service. Is that okay?
Oh, is it, doctor? I didn't know that smoking could affect my fertility. Please,
yes.
Doctor.
Yes. Okay, I will connect you, Emma, soon. Okay. And Emma, tell me about, are you allergic to any medication?
No, doctor.
Any medical condition you have, or you're seeing your GP for on a regular basis?
No.
Okay, and any surgeries on you before?
No.
Any family history of not having fertility problems?
No, doctor.
Okay, and you feel safe and supported at home?
Yes, my husband is very supportive.
Okay, and Emma, tell me about your, have you been feeling low, depressed in the past few months, weeks or months?
Not much, doctor. I just want to know what's happening now. I just want to know. I want an answer for this, doctor. What should we do next?
Yes, I'm coming back. And tell me about the BMI. Have you ever thought of losing weight?
Why, what's wrong with my BMI, doctor? I have told you I thought of losing weight, but why? What's wrong with it? Why can't I just go on with an IVF with this BMI?
Okay, so Emma, let me tell you about the BMI. That BMI is between 19 to 25 is good. At least at 19 to 30 is acceptable for this, fertility. When the BMI is too high, Emma, it affects your fertility. And also, if you get pregnant, it will affect your pregnancy also. So I will try to connect you, Emma, to our dietitian and also our physiotherapist and exercise expertise. They will help you to lose weight. Okay. So coming to your problem, Emma. I've confirmed the name and age and the hospital number, and your reports are with me, the ultrasound report, and it shows that ma'am, can I have that? The uterus is normal, and the ovaries, they show that they are having cyst. Now these are called cyst because you have a condition called as PCOM. Have you heard of this before?
Doctor, I have heard of it, and I'm aware that I have PCOS. I just want to know what this is. I want to know why PCOS is affecting fertility. Why, why is everyone concentrating on my BMI so much? I want to answer for all that.
Yes. So now, coming to that, Emma, when you have a high BMI, that is when your height to weight ratio is high, then your hormones are such that it doesn't allow the eggs monthly to be released. Okay, we need an egg to be released monthly to get pregnant, right? So I see this is a tube, this is your womb, and this is your tube, and this is your ovary, and every month one egg has to be released. Now in PCOS, Emma, what happens is that because of our hormones, that is in this, our male hormone increases. That's why we have excess hair, acne, and this doesn't allow our normal functioning of the ovaries, and the eggs don't come out. Okay, so having said this, Emma, we will attach you to my consultant, the fertility specialist, the counselors, the genetician, the dietitian, the exercise therapist, physiotherapist. All of us will be involved in your care. Okay, first of all, we will help you to lose weight, which is a main strategy which will help you to ovulate. Okay, even if you do normal regular exercise, it doesn't mean that you can, it is going to be 47, or maybe it be high. And also because it be really difficult, the fertility specialist can also help you, send you to certain specialist doctors.
I don't see any change with this diet or any exercise. Is there anything else you can suggest? Any medicines I can take?
Medicines have other side effects also, Emma. Okay, so the best is I would advise you is to the fertility specialist, who can advise you to certain bariatric surgeries where they will help you to decrease the amount of food intake, and those are more strategic points which can help you lose weight. Okay, and Emma, now that you are 4 years pregnant and 4 years married, and your husband he also has to come. We can discuss his results with him later on when he comes. But if we have to send you for any IVF which you were interested in, they want the BMI to be less than 30. Okay, so and you have to also stop smoking. So all
This
this
is
will
your time,
help you,
dear, but still continue, please.
This will help you to lose. These are the few things which are needed to go for an IVF treatment. Okay, so I will connect you to the. I will give you some information leaflet. I will also connect you to support groups. They can also help you how they have managed to lose weight, and then. Counselors, and also I will give you my next appointment with my consultant. Please bring your partner also, and we can have a detailed discussion. Is that okay?
Yeah, doctor, that was really helpful. You have cleared all my doubts.
Thank
is there
you,
anything you want to add, doctor?
I don't know, ma'am. I think.
Yeah, okay.
About IVF, you wanted to find. I asked about IVF. I told that you cannot because your BMI is more and you're smoking. Only that I didn't know about the weight, ma'am. What you have to tell about that 47?
Yeah, that's okay, dear. You covered most of the points. It's okay.
Okay, thank you.
Bariatric surgery.
Bariatric surgery only. She has to go 47. How she's going to lose weight? I don't know.
Okay. So, what do you say? How have you done the?
I was not structured.
That's okay. It's not that bad. No, it's fine. What else?
Time limit.
That's okay. Yeah, information gathering. You took a lot of time for information gathering. You were asking
folic acid and rubella. God, I forgot. I forgot personal history, smoking. Smoking. I asked. Folic acid and rubella. I forgot.
Yeah, just about the follow up further tests. Sorry, like how to follow up, and also about the
blood test. Blood test, no.
Yeah, and maybe long-term consequences you could have added. That's it. But all the important points you have told about it. A little more details also. So anything else you would want to add? Like
We have to talk about HSD. We have to test your tubes. No?
it's already tested.
Okay, ma'am.
It's there in the role player instructions. You didn't ask about it.
Okay.
Okay.
Role player?
That is from my part.
Okay.
Yeah. Okay.
Okay.
Anything else? Any further information you would want to add? My side of feedback as a layman. See, one thing that I found was you need to be a little more confident while you are presenting the task, when you're asking the questions. See, myself, when I'm as the patient, as a role player, when I'm looking up to you, you need to talk confidently. You need to ask your questions more confidently. And when you're explaining everything, you have to prepare everything. See, PCOS is a very, very common task. You need to know how to explain the diagnosis, what a PCOS is, and further investigations, and how do you follow up. Or you covered everything, but you need to do it a little more confidently, in a little more structured way, and it should not be vague. It should be like to the point. Okay. So the same thing, like even in information gathering, the questions you need to ask is it should be crisp. All this Meera will be covering for you. And see, when I was telling you this was distressing for me, I feel frustrated. You said yes, I can see this is really distressing, but at the same time, you should also provide a reassurance. Okay, we are all here. We will be going through this together. Okay, that is very, very important. Okay, that is where the role player will feel that okay, I have been heard, and at the same time, they are ready to give me what I want. Okay, so they will be more comfortable, and they will open up to you better. I'm not telling this is not a bad attempt, or this you have not done it well. Just the thing is, you need to put all these small points you need to add up. Your template of that was fine, but I don't touch upon it. And so information gathering, all this Dr. Meera will be telling you. And you use the jargon, which is uterus. But otherwise, ovaries and all is okay. See, and when you're explaining the PCOS, you should use keep it more simple. Don't tell these hormones, ovaries. Just use the word. It is a hormonal imbalance due to which the egg is not released every month. That becomes very simple, and at the same time, the patient will be able to understand. You don't have to go into the pathophysiology. Okay, that is what I was trying to get from you. I think you're not aware of how to explain PCOS. You will go through the PIL. Okay, all these diagnosis, how to explain the diagnosis, everything will be given in the PIL in a very simple manner. Okay. And other applied clinical knowledge, Meera will be talking with you. And yeah,
ma'am, you the role player wanted to know. Tell me, doctor, what is the problem? So we should be like quick in our information gathering. Okay, she's getting so frustrated. She wants to know her diagnosis. I'll leave all this and go. Is it that way, or I'll tell her that wait, I will. I'm coming to that point.
See, the role player is insisting you what is happening. It's better to tell the diagnosis at that time, and then you can go back to your information gathering. Just you need to tell them, and like what it is, you need to tell them, and then you can take the permission and again go back to the information gathering. Okay. Not give them entire details, because you might miss your information gathering. You must tell them if they ask further questions. In order to explain all that, I need to know a little more about you, so can I ask you a few more questions. But it's important to address their concern, that main concern, and then you can go back to your information gathering.
Okay.
And yeah, BMI, actually smoking, it's better you ask, first you ask, have you ever thought of quitting? Then whatever she would tell, then you talk about the risks, okay? At that time, it will, enter into their brain that, okay, we need to, because of these risks, I have to stop smoking. They will be ready to go for it, okay?
Okay.
And yeah, BMI part, you need to be a little more, non-judgmental. It was fine, but still a little more non-judgmental. And the explanation of how BMI is associated with PCOS, all that has to be, you need a little more improvement. And from my side, I want you to be a little more empathetic, a little more of reassurance, more confident, so that I will be confident that you are a good doctor. Okay?
Okay, thank you.
And
okay. So, Dr. Fatima, that was a fair attempt. Overall, later on, near the timing when it was about to end, you were able to finish it off and rush and try to cover the points. So, I'll be telling from the beginning how you went, and then I'll be giving you certain tidbits on the improvement. All right. Overall, if I should say, your approach is fine. You were able to gauge whatever is her concern. You were able to give about 75% of the information which is needed to be given to her at that point of time. And addressing her concern could be a little bit more nuanced in terms of detailing what exactly she has in mind and what exactly she has to go for from now on. So opening was fine. You were confident and you confirmed her name and age and asked about her concern. There you did not just go on and set an agenda. You asked any particular concern if she has, and then she gave you the information that she has come here for the IVF because she has been trying for quite some time. So if this is not missed if this is missed, like if you did not ask this, she would not have given you that information that she is here for the IVF. I want the IVF. That is her main concern. So the idea is that she has come here for the IVF. So that would have been missed. Now coming to the further things, you asked for permission to go about further questions. So about that time, 30 seconds, but within 30 seconds, you were able to get the main concern. So that was well done. But from then onwards, you asked a lot of details which were not important, which were not particularly relevant. Yeah. So by the time you came to the actual discussion part, only 4 minutes were remaining. Okay, so that is a huge concern because you know right here that BMI is high. She is a PCOS patient and she tells you that she knows that she has PCOS. And she, in between, she told that too, that everything else is normal, tubes are normal. Why am I not getting pregnant? Right? So that came in. So you would need to be getting all those details. And certain things that the role player tells you, you need to etch it in mind. You should not be asking it again, like the partner details, right? The partner seminal is normal. Everything else had been fine. So why is she not getting pregnant? She knows that she has PCOS. So here you can skip certain details like fertility window, the intercourse details, ejaculation details. Those are not relevant, right? You have a particular condition. You know that this is what is the problem and the semanalysis is normal. And she says that everything else is all right. So you should be just jumping onto whatever is the thing in front of you. Right.
So we should not ask about the
fertility
partner, how
window.
any fertility
No,
and
no
all
need,
those
no
questions
need
we have
for
to leave, ma'am.
no need for
Okay.
this task because she is coming to the fertility unit. She has been trying for 4 years now and investigations has been done. She knows that she has PCOS. She wants to know why PCOS is affecting her fertility, like how you explained the ovulation is not happening, which is why she needs to optimize her weight so the ovulation can happen by itself. She might not need the IVF at all. So that's what she needs to know. So when the situation is this, from this point onwards, when she has come to the fertility unit, you need not go back and ask about the fertility window, the erection, ejaculation details, whether partner BMI is all right, partner is all right. All those things need not be asked. Partner semanalysis, it's given to you, it's normal. She doesn't have any other problems related to her fertility except for her PCOS.
So only unexplained infertility we have to ask all this, ma'am. Yeah.
That depends on the situation. What is the station given to you? You assess that station. When the male partner station is given to you, you look at what are all the male partner details, what are all the female partner details, how much do they know? Okay, so that you need to assess the starting point. So once that starting point is assessed, don't go back and ask whatever things had been already been done, would have been done by the GP itself, right?
Okay.
So don't ask all the details. That is going to take time and that is not needed at all. So PCOS questions, related questions like excess hair growth, acne, menstrual problems, everything you address rightly. Once in 3 months, 2 months she gets, but then still you asked LMP, it was 10 days back. So you address that also. So that is the main thing you would need to ask. So menses details, PCOS related questions, and her main concern is that she wants IVF. So cervical smear is not wrong to be asked. Pregnancy also you asked in terms of you or her partner. So these kind of questions you can combine. Okay, you or her partner have any other children outside of this relationship previously. So that will...
Father than a child.
Yeah. So, and the medical, surgical, all those things also you can combine, not a problem. Rubella, all those things are all right. It's not a huge thing to be missed. So right now she needs to optimize weight. She needs to cut down on her smoking and stop eventually. So that is the main deal here. So that is not a particular concern. Okay, so coming to the STI, she had been living with her husband for now quite some time now, and she says that the tubes are all right. So you need not particularly ask about the STI. Okay, when there is any high risk factor, you can mention it. And when she says that the tubes had been normal, you need not go back and ask about STI. Okay. So recreational drugs also you can skip in the station because she says she takes this one, she does smoking. Alcohol, she says no. So smoking is the thing you would need to explore. It's like how Sumi told, you would need to ask about her intentions to cut down or quit. So that would be your first question. And once she says positively, what happened there? Why did she try? Was she not successful? Then you can say that we have other ways to quit also. We will connect you with the smoking cessation services that you can mention. So these things you can create a phrase or two to say so that you are well practiced to go on about it. So this is something which is which can come up in any station, right? So is there anything which you can prepare, like a phrase or something which you can use at that point of time, which could help you with the time? Right. So how we usually talk about is, have you previously thought about cutting down or quitting eventually? And when she says yes, I appreciate that. You can get in touch with, I'll put you in touch with the smoking cessation program. We have other ways to quit also, which can help you with quitting. And this is the best thing you can do for your pregnancy and your child. Okay, so that is something which is appreciative, and at the same time, cut shorts a lot of details. Okay, this can affect her fertility and this can improve her pregnancy. Stopping smoking is the best thing that you can do to your child. So this phrase you can keep in your mind and use it for the maternal medicine station also. So coming to allergies, medical, surgical history, those are all not very fine. You ask that. Family history also, you need not be very long and detailed also. That is fine. Safe and supported is not relevant here. She, as a couple, you mentioned it twice or thrice to come in and meet. So that also is fine. It need not be in so many long words is what I say. Mental status is also you ascertain, because this would have been difficult trying for a long time. How are you as a couple? Do you feel stressed, distressed, anxious? I'll put you in touch with the counselors. I know this could be difficult. So just address that, put her in touch with the counselors at that point of time. Don't come back to that again. So counselors, support groups, communication with colleagues came in 2 to 3 times in the station. That eventually took your time away. Okay. So the information gathering part here, it's only one part of the domain. It's only one domain. It's not the whole task, right? It's only one domain. So go to a targeted history taking approach, which is going to save time for all the other domains which you need to score and for the management part. And the role player is going to ask you certain questions also. So try to finish this in 3 minutes, at the max 4 minutes to start with at this point of time. Okay, in your preparation. Okay. So coming to the management part, the main concern, so even if you knew, you were not able to put it in much of clarity what she should be doing. So I know you have come for IVF, but IVF is not something which would be offered to patients with PCOS at this point of time, mainly because there are certain factors which can help you with getting pregnant by yourself, by like weight reduction, cutting down on smoking, and regularizing your menses. That if all these things are done, you can get pregnant by yourself. And we have certain ways in which we can help you with these kind of, with the weight reduction. And tell what are all the modalities. You told the bariatric surgery, that is fine. And she asked about the drugs. You mentioned the side effects. That's why you wanted to avoid. That is all right, but there is a better way we will discuss in the key discussion. But good that you mentioned bariatric surgery in one go and went on with the repeated again. You mentioned about the communication with colleagues, and there you your time was up. So that was it. Because of the information gathering part, you were not able to come to the focused management.